This week sees the publication of a document which I think is genuinely important and I hope will assist in changing the way in which MDMs are run at the interface between cardiology and cardiac surgery. It is the fruit of a working group which has got together over the last 10 months or so, consisting of members of the British Cardiovascular Society, along with representatives of the British Cardiovascular Intervention Society, the British Heart Valve Society, the Society for Cardiothoracic Surgery, and the Association for Cardiothoracic Anaesthesia and Critical Care. We had to tackle some quite difficult issues in the working group, and I think it's a great credit to those involved and the leadership of the societies that they represent, that at all times our discussions were collaborative and I think have resulted in a document that will be genuinely useful. The core document describes how MDMs should be constituted and run. It describes the key roles within multidisciplinary meetings and, importantly, the role that patients and their relatives play in the run-up to the MDM, potentially in the MDM itself, and importantly, in the communication of decision-making following the MDM. It describes also how decisions made at the MDM should be reported back to other clinicians and how those decisions in turn needed to be audited to ensure that the MDM functions in the way in which it is supposed to. We then go on to look at subspecialty MDMs in myocardial revascularization, aortic valve disease, mitral and tricuspid valve disease, and endocarditis, and look at the specific issues that are likely to come up in each of these individual arenas. It is unashamedly an aspirational document, and it is certainly the case that all our recommendations will not be able to be enacted immediately in every cardiac centre in the UK. However, it's also important to emphasise there is nothing that we are recommending in this document that is not already being done somewhere to good effect. So I commend it to you. I urge you, if you're interested in MDM functioning or you are a member of an MDM in relation to cardiology and cardiac surgery, to look at this document on our website or on the websites of the other organisations involved, and I hope you find it useful. Thank you.